The healthcare landscape is evolving rapidly, with artificial intelligence, AI, playing an increasingly prominent role. From analyzing medical images to optimizing hospital workflows, AI is revolutionizing how we think about medicine. But as AI becomes more capable, a critical question arises. Will AI replace your doctors and nurses? The idea of AI taking over healthcare jobs is both intriguing and concerning. While some tasks may be automated, the full picture is more complex. Today, we'll explore whether AI can truly replace healthcare professionals, considering its strengths, limitations, and the irreplaceable human element of caregiving. AI's growing role in healthcare. AI in healthcare is no longer just a futuristic concept, it's already here. It's being used in a variety of applications, such as 1. Diagnostics. AI-powered tools can analyze medical images like X-rays, CT scans, and MRIs with remarkable accuracy. For instance, algorithms trained on vast datasets can detect early signs of conditions like cancer, diabetic retinopathy, and pneumonia, sometimes outperforming human radiologists. 2. Administrative efficiency. AI simplifies tedious tasks such as scheduling appointments, managing medical records, and streamlining billing processes. This allows healthcare providers to focus more on patient care. 3. Personalized medicine. By analyzing a patient's genetic information, AI can help tailor treatments to their unique biological profile, making medicine more precise and effective. These advancements illustrate AI's transformative potential, but they also raise the question: can these capabilities extend to replacing human caregivers? What AI does better than humans? AI has distinct advantages over humans in certain areas, especially those requiring data analysis, consistency, and speed. 1. Speed and accuracy. AI processes vast amounts of data much faster than humans can. It doesn't get tired or distracted, and its outputs are consistent, making it highly reliable for repetitive tasks like analyzing test results. 2. Pattern recognition. AI excels at recognizing patterns in complex datasets, which is critical for early disease detection and predictive analytics. For example, AI systems can identify correlations in patient records to predict future health risks, enabling proactive interventions. 3. Cost reduction. By automating routine tasks, AI can reduce operational costs, making healthcare more accessible and affordable for patients. While these capabilities are impressive, healthcare involves more than just efficiency. It requires a deep understanding of human emotions and ethical complexities. The importance of the human element in healthcare. Healthcare is fundamentally a human-centered field. Doctors and nurses don't just diagnose and treat. They also comfort, empathize, and connect with patients on a deeply personal level. Imagine these scenarios: a nurse holding a patient's hand before surgery to ease their anxiety. A doctor explaining a life-changing diagnosis with sensitivity and compassion. A caregiver recognizing subtle emotional cues that indicate a patient's unspoken needs. These moments are essential to healing and cannot be replicated by machines. AI lacks emotional intelligence and the ability to form meaningful human connections, which are integral to patient care. Collaboration, not replacement. Rather than replacing healthcare professionals, AI is better viewed as a collaborative tool that enhances their capabilities. Here's how AI and human caregivers can work together. 1. Assisting in decision-making. AI can analyze medical data and provide insights, helping doctors make more informed decisions. For instance, AI can suggest treatment options based on a patient's history and current condition. 2. Freeing up time for patient care. By automating administrative tasks and routine monitoring, AI allows healthcare workers to spend more time focusing on their patients. 3. Telemedicine enhancements. AI chatbots can assist in initial consultations, triaging patients based on their symptoms and prioritizing cases for further attention by doctors or nurses. In this collaborative framework, AI becomes a powerful ally, not a replacement, ensuring that human caregivers remain at the forefront of healthcare delivery. Challenges and limitations of AI in healthcare. Despite its potential, AI faces significant challenges that make replacing doctors and nurses unlikely in the near future. 1. Data bias. AI systems are only as good as the data they're trained on. If the data is biased or incomplete, the AI may provide inaccurate, or even harmful recommendations. For example, an AI system trained predominantly on data from one demographic may not perform well for others. 2. Complexity of medical cases. Not all medical cases fit neatly into patterns that AI can recognize. Rare diseases, complex conditions, and unusual presentations often require the intuition and expertise of human doctors. 3. Ethical concerns. Can AI make ethical decisions in life-and-death scenarios? For example, if resources are limited, should AI decide who gets priority treatment? These are questions that go beyond algorithms and require human judgment. 4. Accountability. Who is responsible if an AI system makes a mistake? Is it the developer, the hospital, or the healthcare provider using the technology? These questions complicate the widespread adoption of AI in critical medical roles. 5. Lack of emotional intelligence. AI can't provide the emotional support that patients often need during stressful or painful experiences. Trust and reassurance, essential components of healing, can only come from human interactions. Will AI replace certain roles in healthcare? While AI is unlikely to replace doctors and nurses entirely, it may reshape specific roles and tasks. 1. Diagnostic roles. AI could reduce the need for certain specialists, like radiologists or pathologists, by automating the analysis of medical images and lab results. 2. Routine monitoring. AI-powered devices can handle tasks like monitoring vital signs and reporting changes, reducing the workload on nurses. 3. Administrative positions. Administrative roles, such as medical coders or billing staff, are more vulnerable to AI automation due to the repetitive nature of their tasks. These changes are not about elimination, but rather redistribution. Healthcare professionals will focus more on areas that require human expertise, creativity, and empathy. The future of healthcare with AI. The future of healthcare lies in a balanced integration of AI and human professionals. As AI continues to evolve, so will the roles of doctors and nurses. 1. Upskilling the workforce. Healthcare workers will need training to understand and work alongside AI systems. This includes interpreting AI outputs, ensuring ethical use, and maintaining accountability. 2. Enhancing patient care. By taking over routine tasks, AI allows healthcare providers to concentrate on what they do best, providing compassionate, personalized care. 3. Ensuring ethical AI use. Healthcare institutions must develop clear guidelines to address ethical concerns and ensure that AI serves patients fairly and transparently. Rather than fearing replacement, healthcare professionals should view AI as an opportunity to enhance their impact. So, will AI replace your doctors and nurses? The answer is clear. No, not entirely. While AI can handle repetitive tasks, improve diagnostics, and enhance efficiency, it cannot replicate the empathy, intuition, and ethical decision-making that define human caregiving. Doctors and nurses are irreplaceable because they bring more than knowledge to their roles. They bring heart. AI will remain a valuable tool in their hands, enabling them to provide better care to more patients. The future of healthcare is not about choosing between AI or humans. It's about combining their strengths to create a system that is smarter, more efficient, and more compassionate. What are your thoughts on AI in healthcare? Do you see it as a threat, an opportunity, or both? Let us know in the comments below. If you found this discussion thought-provoking, don't forget to like, subscribe, and hit the notification bell for more insights on the intersection of technology and healthcare.